chain drug review, and mass market retailers video forum. Brought to you by the Emerson Group.
Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today, we're thrilled to have as our guest Lucille Accetta, Senior Vice President and Chief Pharmacy Officer at CVS Health. Lucille, great to have you with us.
Oh, thank you, Jeff. Really happy to be here.
You guys recently issued your 2025 RX report, Community Pharmacy Reimagined. One of the findings was 65% of adults are interested in pharmacists being a guide to them and connecting them with other healthcare providers and services. How is CVS responding to that finding?
So, Jeff, traditionally pharmacists are known for dispensing medications, providing education, advice, and counsel. But the profession is really expanding its scope of practice, and the types of services and care that we provide is, as you know, administering more than a dozen vaccines and testing and prescribing medications for influenza and COVID where allowed. And, we've also launched unique centers of excellence to support patients. And we know that patients trust their local pharmacists and their pharmacy team, and that there's much more that pharmacists and technicians can do to support their community, their public health, and practice at the top of their license. So that's why we're supporting a lot of legislation that will preserve access to pharmacist-led services and testing, and really move forward with letting our pharmacists increase their scope of practice.
And how do the presence of minute clinics in many of your stores affect that dynamic?
Jeff, they work together, right? Sometimes the minute clinic can do a little bit more of the services like infectious care and disease, sinus infections, and many things like that.
Lucille, one of the most interesting things I found was that pharmacists and patients both seem to like in face-to-face interaction. They both see the value in that. And with all the talk of mail order and Amazon Pharmacy and other places, what does that say to you? And what does it mean for CVS, and what does it mean for the industry going forward?
Yeah, the research definitely showed that continuing an in-person care still remains really important to patients, and that they trust their local pharmacy team. And the 80% of patients prefer that face-to-face pharmacy care. And even in the survey year over year, you're seeing that nearly half of the patients would switch a pharmacy if they were only limited to a digital only option. So that tells the story right there that people really need that face-to-face. And even the pharmacy professionals that are taking care of patients prefer that in-person interaction, as well as being critically vital to the interaction with patients. But we have found that having some digital tools does help make the process easier for patients, like getting a refill, a notation that it's ready, making things easier for them for that convenient check-in at the with the pharmacist. And there's a lot of new innovations that we're also doing to simplify that check-in process, at the counter, so that it's easy for them to tell them that they're there and what medications are ready for them. So really, at the end of the day, you really want to just reaffirm that the local community pharmacist really does make a big difference in that face-to-face interaction. Where else can a person come into a local pharmacy and be able to get that moment or interaction with a healthcare provider today? Typically today, that's one of the only places you can step right up and have a clinical interaction with a clinical professional.
And you talked about technology tools. Have you looked at that, how the combination of the pharmacist in person plus the digital tools benefit the customer?
Well, the technology is actually making the practice a lot more convenient for the pharmacist so that they can interact more with patients, right? So the technology getting integrated into the workflow also enhances the patient care, one from a safety perspective for sure. And we continue to invest in a lot of these innovations to support our colleagues. And one of them I'll share, Jeff, is the Smart DUR, which is a drug utilization review. It looks at your medications, it looks for drug interactions, it looks for anything that's duplicative or any potential side effects. So that is one area of safety and capability that we have embedded in the system. We also have something called a dynamic workload sharing model. And imagine, you're working in pharmacy A and I'm 2 miles away in pharmacy B, and Jeff, you're really behind and I'm up to date. I can actually help you in the system to manage the workload that you're having when you're falling maybe a bit behind. And these are a lot of the innovations that we're doing to modernize the way pharmacy operates. And we also have looked at, I don't know if you've even heard, when you walk into one of our pharmacies, you don't hear the phone ring anymore. And that is another way to intake that information for the pharmacist to be able to react to the phone call without hearing the phone ringing all the time. So all of that work is, again, to bring back some more time to our pharmacy colleagues, take away that administrative burden, be able to give them the opportunity to engage with patients more deeply in their care. And the whole premise is to increase safety and continuing to build that trusted connection in the local community.
And I assume the pharmacists have reacted enthusiastically to these innovations.
Absolutely, they have.
So another innovation is you're looking at some new small format stores for underserved markets. Maybe you can tell us a little bit about the thinking behind it and why this seemed like the right time to take that approach.
Well, community pharmacy is the most accessible and trusted healthcare provider setting that there is, right? You can walk right in. And we know patients prefer the face-to-face, as we just discussed, over the digital options. So continuing to meet patients where they are, that's what we're trying to drive with access to care. So we did open nearly 100 new community locations this year, including more than 60 in the Pacific Northwest, which was an area where we typically didn't have pharmacies. And this is really trying to expand the care in these communities. And then in certain areas, we're launching that new small format pharmacy. And these are more in underserved areas where we'll offer your totally full service pharmacy like you see today, with immunizations, medication support. But the front of the pharmacy is very much a health and wellness product selection. Painkillers, cough and cold, vitamins, things like that are more selective, but not the full breadth of the front store. Now, in fact, the RX report showed that the majority of Americans prefer coming in and interacting with their local pharmacy. So we thought these small format pharmacies would be beneficial in underserved areas. And we'll have a lot more to share in 26 about these as well.
Maybe you can tell me what additional steps CVS intends to take to support pharmacists in the future, both their day-to-day activities and I guess the growth of the profession and an expanded scope and such.
Yes. Well, the future really rests on our pharmacy teams. We're really out there making sure that we're informing students about the profession, but we are so investing in tuition assistance because we know that 77% of technicians out there say that tuition assistance would increase the likelihood of pursuing a career in pharmacy. And we have some really amazing technicians out there. So that's one of the areas that we're investing in is tuition assistance, scholarships, and partnerships with pharmacy schools. So for the Tomorrow Pharmacy Leader, we have launched the PharmD tuition reimbursement program. We've also partnered with the American Association of Colleges of Pharmacy in tuition support there. And we also landed a very wonderful collaboration with Duquesne University, which is also helping with pharmacy school tuition. So all in all, we're really supporting that and investing in that next generation. And that's really where we're finding we can help them become future pharmacists.
Lucille, before I let you go, I want to ask, you mentioned immunizations a couple of times.
Yes.
There's a lot of noise and controversy around immunizations at this point. How is the season shaping up? Are you seeing the same sort of demand so far?
Yes. We are seeing the demand, flu, COVID, and many other vaccines that we offer. I think we offer over 12 of different types. And yes, we are still maintaining that the teams are immunizing.
Oh, that's good to hear. And I'm sure your pharmacists are providing some very important guidance and information to people who come in the stores.
That they do.
Okay. Well, we appreciate the update and thank you so much for sharing your thoughts with us. It's been a pleasure.
Thank you, Jeff.